I'm going to briefly present the results of a phase 2 trial looking at pazopanib in women with recurrent ovarian cancer, and this was done in collaboration with a number of groups in Australia and the United States. As brief background, chemotherapy, as I'm sure most of you are aware, has been standard management for ovarian cancer for many years, but despite an enormous amount of effort, the overall prognosis for women with advanced ovarian cancer is still poor, and the majority of women with advanced disease will unfortunately relapse. We now understand that angiogenesis plays a critical role in the biology of ovarian cancer, and it is a very attractive target. We are going to be discussing briefly pazopanib, which is an oral inhibitor of angiogenesis, and the primary endpoint of this study was looking at the CA125 as a biomarker or a marker of benefit. CA125 is widely used in clinical practice. There are accepted criteria for both response and progression, and we reasoned that in patients with a rising CA125 after relapse after first or second line chemotherapy with small volume recurrences would provide an ideal opportunity to look at a new novel agent such as pazopanib, where we thought that perhaps the response rates would be higher. And it's also interesting to speculate that perhaps with some of these newer agents we may not always see objective responses because they can be cytostatic. So that's the rationale for the study. It was a two-stage design. In the first stage, we planned to recruit 20 patients, and if the CA125 response rates were seen in less than 2 patients, we would conclude that this was an active agent, at least in this tumor type, and close the study. However, if there were more than 2 CA125 responses, we would go on to recruit an additional 15 patients. And when we analyzed the data, we had criteria that we set at the very outset, and that if there were more than 7 responses seen, we would conclude this was a positive study and consider further investigation. The adverse events are shown in this graph. This is regardless of causality. The side effects are not dissimilar to those seen and experienced with similar agents, either angiogenesis inhibitors or tyrosine kinase receptor inhibitors, and they were predominantly hypertension, nausea, fatigue, diarrhea, and also abnormal liver function tests. Most of the side effects were relatively low grade, grade 1 and 2. In terms of response, 36 patients were entered in the study. 11 patients met the criteria for CA125 response. These are accepted GCIG criteria for response. Most responses occurred very rapidly. Within 29 days was the median time to response. The median duration was 113, just under 4 months. And most women who responded to treatment, the responses were durable, greater than 12 weeks. This waterfall plot actually shows the results perhaps a little bit better. You can see quite clearly that the green bars represent stable disease, and the orange, the 50% response rate. You'll notice that there are 2 patients in the bottom part of the diagram here who had green bars where there was a 50% fall in CA125, but we've included those as stable disease as we were unable to confirm a CA125 response more than 21 days later, so they were confirmed as stable disease. Another way of looking at it is tracking the CA125 levels over time, and you can see in the slide that many of these responses were quite durable, and indeed there's still 3 patients on study up to 2 years. So in conclusion, this study demonstrated that using CA125 is a good opportunity to investigate the activity of novel agents such as pazopanib when tumor volume is low. 31% of patients had a CA125 response. The median duration of response was 113 days. In general, it was well tolerated, the most common side effects being diarrhea, fatigue, abdominal pain, and hypertension. And in light of this data, further studies are planned, and a phase 3 study is being considered at this present time. Thank you very much.